Hi, a medical appointment or a checkup can be daunting for children, especially when they have to do procedures, treatment, which may cause a lot of pain. Thus, preparing them appropriately is important to reduce anxiety and stress among the children and their caregivers. In this course, tips on supporting, preparing children for medical procedures or treatment will be shared. Research has shown that children are more cooperative, less anxious when prepared, what to expect through their 5 senses, and have pain coping plans. Now, before I begin, I would like to share about Child Life Services. As a child life therapist, I prepare and support through their medical learning journeys. Adjustments and lifestyle changes after diagnosis sharing are crucial in medical compliancy in the long run. Many patients require support to go through countless procedures, treatments, anticipating pain and bodily changes. But how can medical team members engage or communicate with their young patients effectively, complying medically? Now, before we do that, let's look at what causes the child stress. Most children would feel suspicious of strange people in this strange place called clinic or hospital. The medical environments look, smell, feel different from children's familiar homes and schools. In a child's voice, the people wear funny clothes. There are children crying. These people touch me without my permission. Where are these people bringing me? No, don't poke me. Help. Mommy, I'm scared. Medical personnel are aliens to most children. Some children warm up faster than others. Touching children without their permission is a big deal with them. It may violate their trust in you. Identifying children's fretful behavior is necessary to understand their behaviors during times of fear and anxiety. For developmentally normal children or normal children, the expression of anger, fear, pain, and crying vary from quiet sobs to howling loudly. The children may be physically reactive, kicking and hitting people around them. They would also try to run to their safe person, usually a caregiver. Nevertheless, they can be consoled, calm with comforting hugs, words of caregivers, and most times a fretful patient can be distracted by objects and people. Some love to be rewarded for their cooperative behavior during procedures. With these behaviors in mind, how do we support children under our care during their medical appointments? A coping plan is recommended to be explored between caregivers, patients if possible, the medical team, and a child life therapist if necessary. For children who are developmentally normal or normal children, the coping plan is explored even before the medical appointment. Best would be orientating and navigating around the hospital or clinic, observing the medical team and patients in the environment. Verbal assurance is given that the people in the environment support the children and their caregivers. The medical environment, such as hospital and clinics, can be a busy, chaotic one. Thus, finding quiet, calm spaces are important too. The child can choose to rest or play quietly to calm down at the waiting area, for example. Another factor is the choice of caregiver to support the child's medical experience. It's best for the caregivers to decide among themselves, but occasionally, medical personnel and child life therapists would have to facilitate this choice. A preferred caregiver would be the one who is calm and able to support the child's wonderings about their medical experiences and journey. Jessica Lloyd, MD, a pediatric hospitalist at UCLA and assistant clinical professor at the David Geffen School of Medicine at UCLA, has picked out some tricks of the trade. Here, she shares tips for talking to your pediatric patients. One of the most important aspects of communicating with the young patients, she shared, is to look them eye to eye and smile. A smile communicates friendliness and may be able to lower patients' and caregivers' anxiety in the clinic. Using medical terms that are child-appropriate is crucial as it includes the patient in the medical discussion between caregivers and the medical team. Language medium may not be English, but a language which is more appropriate for the patient to understand. Be honest and truthful. Child patients have knack for adults who are not truthful or trying to coax them to do something which they do not like. Explaining to the patient that the medical treatment or procedure is not a choice, but how the patient wants it to be done is in his or her court. Some patients are fearful when they see many strangers in a room looking down at them. Just imagine a bunch of strangers staring, poking and touching you without your permission. Thus, having a minimal number of people in the clinic is always a good idea, and ask permission from the patient before touching his or her body. On some occasions, when things become overwhelming, for example, The patient and caregiver seem highly stressed. Patient is crying, refusing to cooperate with caregiver or medical personnel. Give the patient and caregiver some time and space to calm down. There are instances when medical teams tried to support a fretful patient but escalated the environment into a tug-of-war between patient, caregiver, and medical team. One effective way to create a patient-friendly environment is to place age-appropriate toys in waiting area and clinic for patient to play with. Medical teams and caregivers can use these toys to engage the patients in expressing their worries and anxieties. So keep calm and play. Play has many benefits in reducing anxiety and stress in children, especially during medical appointments in clinics and hospitals. As quoted from a study, Importance of Play During Hospitalization of Children, play has high therapeutic value. It gives a sense of control and calm over many situations a child or patient does not understand or creates anxiety. Thus, play becomes a coping mechanism. It is also a thought process when a child or patient demonstrates and rehearses a procedure to prepare him or herself mentally. A subset of play is medical play or medical role play. Let's explore what medical play is. The main objective of medical play is to reduce patients' anxiety or fear of medical treatment or procedure by creating a coping plan. Also, it explores patients' understanding of his or her diagnosis and clarifies any doubts on diagnosis or treatment and procedures. The coping plan prepares the patient for the sensations or feelings to expect. What is normal and what isn't? With medical play, procedures are demonstrated, rehearsed, creating a sense of familiarity over them. With the coping plan, we hope the patient understands and copes with his or her diagnosis or treatment and procedures and be medically compliant. One of the important aspects of medical play is mindfully being patient-centric. It is all about the patient, not the caregiver's needs nor the medical team's recommendations. Medical play respects the patient's choices and expression towards medical compliancy. What tools or toys are used for medical play or role play? A non-intrusive way of demonstrating a procedure or treatment is to use a doll. The doll could represent the patient or anyone else who is about to go through the same procedure. With the doll, the patient will also be able to direct his or her play while exploring a coping plan with a medical personnel or therapist. Genuine medical equipment is used to allow patients to touch and feel them and overcome their anxieties over them. Sometimes, patients would not want to touch them out of fear, so slowly familiarize them with the help of their caregivers or the doll. There are many different tools or toys to demonstrate medical play. Sometimes miniature medical equipment is used, example, the MRI machine. Body charts, art materials, though, are used to express the patient's ideas, feelings about their diagnosis, treatments or procedures. Distraction toys like shakers, rattles, smartphones are used to distract the patient during a procedure. The distraction toys are usually brightly colored, noisy and interesting to the patient. Some older patients would choose to be distracted while coping with the procedure and may use these items to look away and digress the pain. To summarize this presentation, it is important that patients' expression of feelings, may it be anger and anxiety or happy and excited, be respected and understood. We express our understanding and respect by communicating with the children or patient appropriately. Good eye contact and sharing with them information which is easily understood by them and their caregivers. To further enhance their understanding, medical play is used to demonstrate, prepare or support a child for procedures or treatment. It can also clarify any misunderstanding or misinformation of their diagnosis, treatments or procedures. With these plans in place, we hope the medical experience or journey of the patients and caregivers would be a less anxious one. To end, I wish you all a pleasant learning journey.